Every breath you take depends on millions of tiny air sacs and open airways working together inside your lungs. In chronic obstructive pulmonary disease, or COPD, years of irritation from smoking, air pollution, or harmful particles trigger persistent inflammation inside the airways. The delicate lining of the bronchi becomes swollen and thickened. Excess mucus begins to build up, narrowing the pathways that air must travel through. At the same time, the tiny air sacs called alveoli gradually lose their elasticity. Their fragile walls become damaged and can break apart, creating larger, less efficient air spaces. Healthy lungs expand and recoil like an elastoballoon, pushing stale air out with every breath. But in COPD, the lungs lose that natural recoil, trapping air inside. As more air becomes trapped, less fresh oxygen can enter with each breath. The body must work harder just to move air in and out. This is why people with COPD often experience shortness of breath, wheezing, chronic coughing, and increasing difficulty performing everyday activities.